You know, we heard already what defines youth. I think we have to start with that. Otherwise, we start creating arbitrary definitions of youth that don't represent youth at all. I like this photograph because the position is pretty similar. If you look at this over about a 20-year time gap, it looks like the brows are hanging, it looks like the skin is hanging, it looks like everything is gravitational in nature. But if you look very carefully and measure everything, the brows are relatively the same height. The eyelid skin on the right has probably fallen a short distance, but it also has gone up a little bit on the left. So there isn't a significant gravitational component to an area that looks extremely gravitational in nature. And if you look more carefully, you can see the bone exposure around the rim, and that's really everywhere, you know, from the anterior cheek, outer cheek, into the chin. And a lot of times, though, that from this 20-year time gap, women don't necessarily want to have this much fullness or baby fat of our teenage and early 20s. So if you look at this photograph, you can see in a very short time frame, over 5 years, there's already more deflation. If you take that model, you begin to see that really, I look at aging sort of like a glass of water emptying. There's this ongoing evolution of volume loss. But there's also other changes in volume gain as well. So we're going to talk about a little bit about the gestalt of looking at a face. And we're going to talk principally here, of course, about volume. The other issues are covered very well today. So we're going to talk about what instantaneously, when you see a face, does it read for you youth? Is it a wrinkle? You know, even if someone's about 20 feet away, you look at them and you can already see that they look youthful. So what is it? It's about an overall shape. You saw earlier in the earlier talk that just a blurred image, you can already get a sense of where that aging is. And I think in youth, there's a lot of baby fat. If you think of that glass of water emptying, you start to see that we have a lot of baby fat, and just that fat is just an evolution of loss over time. As we go into our teenage years, there's still a lot of baby fat. We get into our early 20s, a lot of baby fat. And we just continue to lose fat. It's just this evolution of fat where you're starting to slim down into our mid to late 20s. And then as we get into our 30s, a lot of women say that's an ideal. When they pass 35, 40 years of age, they don't necessarily want the amount of volume when they go back and look at their photos in their early 20s, which is very interesting. So there's almost a triangulation to the face. As we get older, the dominance of the lower face starts to become more obvious, and I think there's a squaring effect, almost a masculinization. And a lot of times overlifting can further masculinize the face. The idea is that as we gain weight, as we get older, metabolism slows down and our lower face starts to dominate. Our attention moves away from the face, from the upper face, and it starts to go down to our lower triangle, which is exacerbated by further aging. And as you start seeing much older aging, the periorbital hollowing and accentuation of the jawline and the jowl region starts to create a full lower triangle. So the goal is to invert the triangle. Some of the subtleties that I'm going to talk about today in evolution over the last few years is to sort of think about more of an oval. And that really means understanding the buccal area. And we're going to talk a little bit about what that means. The ideal beauty in New York Times last year, they had an article, was someone in their early 20s, almost this sort of, you know, prepubescent to pubescent look, or even late teens, or that whole period of time. Oftentimes, if you talk to their patients and you use those old photographs and dialogue, it may not be the ideal. So what is it? We talked a little bit about facial shape, and I think if you start to read that, and when you go back and look at those old photos, and you go with an instantaneous evaluation, you're going to start seeing that the facial shape is huge. And I think that, you know, implants work very well, but you got to be careful, because if soft tissue is a principal mechanism by which there's loss in the face, an accentuation of bony landmarks through using implants may not be the ideal, especially around the eye region. And I think what's really important to start out with is a patient re-education, re-evaluating the patient and having them not go through their laundry list or their catalog of concerns, which are eye bags, wrinkles, folds, gravity, over and over again. And the reason for that is that when we talk about anterior chin hollow, transition points across the cheek in the buccal region, they don't know that, and that's because it's not in their vocabulary, and it may not also be in yours. So the goal is to sort of re-look at the face from a distance, because I always talk about that understanding the blink effect of just seeing a patient from an instantaneous perspective. If you see someone else, you see, oh, that person looks good or bad, even at 20 feet. So we got to get away from the very microscopic evaluation of our own faces. And so this is something that Mike Nyack, a surgeon out of St. Louis, came out with. I think it's a really nice way of thinking about this, which is, you know, in youth we're a grape. As we get older, we become a raisin. Why stretch it and pull it into a pea? We just need to make people look like themselves, which is reinflation. We're going to talk a little about some technical pearls, how to do this safely. Obviously, experience and conservatism are watchwords when we work with this. The easiest place for me to harvest are the inner and anterior thighs and lateral thighs when a patient is supine. I do my procedures under general anesthesia. It makes things much easier, not have to reposition the patient. And I just use a harvesting cannula where I'm using 2 to 3 cc's of negative pressure there. The idea is that there's many ways to skin a cat. I know people that centrifuge, I know people that wash it, and there's a lot of dogma into, oh, you can only do it this way. And I see a lot of longevity with a lot of different techniques, so this is not meant to be absolute by any stretch of the imagination. And the tulip cannulas, I don't have any financial affiliation with them, works very well for me. I've used all the cannulas and they all work, I think, very well. The goal here is to be careful. We're going to talk a lot about it is sort of long-term changes with fat and being very, very careful of not trying to overstuff a face. You can create a very fat face and make something look very unattractive over time. And we're going to talk about understanding where those changes occur. The other thing that's important is something that I really like talking to some colleagues, and it came up with my idea in Vegas just a few months ago, is that fat is like cottage cheese. In other words, it's very soft. It doesn't have the ability in most cases to augment a fold or a crease very well. And then what you start doing is stuffing a face to try to lift these little creases or folds. And I think without much success, it's a very soft contouring capacity. And I use Restylane and Perlane and other modalities to manage lips and lines more than I use fat for those elements. Although obviously a lot of people can show very good results in those two areas. I just find that the predictable nature of putting fat into lips and lines, where traditionally people have put it, has not been as successful in my hands. The goal is not to look at the whole world through a very narrowed, constrict paradigm, but also understanding that there may be a role for a facelift, there may be a role for other things. And like Dr. Lambros, I don't do a lot of brow lifts anymore. And I really believe that a conservative upper bleph, possibly adding a transconj bleph when there's a significant steatoblepharon, is a very helpful thing. I would say about 80% of my lower eyelids are fat only, and I would say the remaining 20% are fat plus maybe a transconj. I don't remove skin just not wanting to get any of the risks of changes in the eyelid shape. The book that I wrote a few years ago with the glass golds talks about sort of understanding this through a cookbook formula so that you can approach this without fear. And the idea is to start slow and just do a very simple foundation work on the face and then building from it and then moving to areas of higher morbidity. These are some of some of the drawings for the book, just to go through some of the areas that in those 3 stages of treatment. The fat grafting is a very tactile skill. A lot of times you don't quite see the plane you're in, you feel it. And so this is where I sort of break it down into a deep supraperiosteal plane, into a medium plane sort of in the mid-subcutaneous SMAS region, and then in the very superficial area getting closer